Hey guys, welcome back to our conditions video series. In this video, we're going to discuss hip osteoarthritis. Now, before we get into the condition, let's do a little anatomy lesson, okay? A lot of my patients come in and they say, oh, my hip is bothering me, I have so much hip pain. But they point back here to their glutes. The thing is, the hip is actually in front of the glute. It's a ball and socket joint. That means that the pelvis has a little socket here, and the leg bone has a ball on top that connects into it, allowing you to move your leg freely. Now what happens is, on this little ball here, we have some cartilage that allows the glide to happen smoothly and freely. Over time, that cartilage can become damaged and start a process called inflammation or arthritis. So what exactly is arthritis? What's that process? Well, pretty much what it is the joint becomes inflamed. The muscles around the joint become tight and stiff, and inside the joint there's less lubrication because of the inflammatory process. Our patients who have hip osteoarthritis complain of pain that usually is in the groin area and it wraps around to the glute like in a C shape. The pain is usually dull. As the disease gets worse, it becomes more sharp. These patients have more pain when they're going from seated to standing, and especially when they've been seated for a long period of time or when they've been laying down or sleeping and get up to stand. They also have trouble with other daily tasks like going upstairs, putting on their socks, and shaving their legs. Now, anyone can have hip arthritis, but we see it happen more in certain populations. We see it happen more in those who stand on their feet all day for work or for certain hobbies. We see it more commonly in men than women, and we see it increase about the age of 40 and above. Now, there are other things that can cause hip arthritis. Those who are obese can have hip arthritis, and those who have any genetic components, such as if your parents or your siblings have arthritis, then you'll have it as well. So now that we understand what hip arthritis is, I want you guys to stay tuned. In our next series of videos, we're going to talk to you about how we diagnose it in our office, how we treat it in our office, and then what things to do at home to get better faster. So stay tuned, guys, and I will see you in the next video.